My name is Alice Martin, and I am the Head of Research at the Work Foundation, a policy think tank which is part of Lancaster University. It's my pleasure to welcome you to today's discussion, Stemming the Tide, Healthier Jobs to Tackle Economic Inactivity. At the Work Foundation, we are committed to supporting people to access well-paid, secure employment, and our current work programme is particularly focused on the relationship between health and work. The health of the UK workforce has faced significant challenges in recent years, marked by rising illness, stalling life expectancy, and according to official data, the UK is still the only country to have a smaller workforce in Europe than before the pandemic. Notwithstanding some limitations with the labour force survey and some cross-national differences in how inactivity is measured, it's clear we have a significant health-related challenge or challenges facing the UK workforce here. So there are now 2.78 million people who are economically inactive due to long-term ill health, which is a near record. And as reported by the Health Foundation, the number of working age people with a diagnosed major illness is rising and is expected to reach 3.7 million by 2040. Mental ill health now accounts for around half of all work-related illnesses, and whilst these challenges mirror global trends, UK policymakers have been slower to respond than other countries. There is, however, now a significant government focus on this issue. The government has set an 80% labour market participation rate and has launched a review led by Sir Charlie Mayfield into the role of employers in reducing health-related inactivity. And we hope that today's discussion will provide really useful evidence and provocations to contribute to this growing policy focus, which we really support. So we will start today with a presentation from Asli Atay, who will share key findings from our latest research, followed by reflections from our panellists. After that, we'll move into a moderated discussion and open the floor to your questions. We will wrap up promptly by 3 p.m. A few quick housekeeping notes. We are recording the session. If you'd like to ask a question, please use the Q&A function at any time during the event. To join the conversation on social media, we're using the hashtag #StemmingTheTide. And I will hand over now to Asli Atay before introducing our fantastic panel who will be responding to Asla's presentation. Over to you, Asla.
Thank you very much, Alice. Good afternoon, everyone. Thank you for joining us today. My name is Asli, and I'm a Senior Policy Advisor at the Work Foundation. I'm excited to present our research findings as well as recommendations from the Stemming the Tide report, which you can find on our website. Let's dive right in. So this report was born out of a simple but critical idea. Over the decades, we know that the government efforts often prioritized getting more people into work. And there were reasons for that, but much less attention is paid to helping employees in staying in work, particularly those dealing with health challenges. And as Alice mentioned, more recently, the government has set this ambitious target of having an 80% of the working age population in employment. While this target is welcome, that also means that we need over 2 million more people in jobs. But here is a challenge to this goal. Since the pandemic, we see a significant number of people leaving the workforce due to long-term health conditions. And this situation has far-reaching consequences, not just for individuals, but also for employers and the welfare system altogether. And as Alice was mentioning, while traditionally physical health conditions like musculoskeletal problems were the leading cause of work absences, more recently we see that mental health conditions have overtaken them as the primary reason people leave employment, as well as also stay out of the workforce. So this is an economic challenge for our country as well. As the cost of health-related benefits continues to rise, they're also placing added strain on organizations as well as public system. This also becomes a much more significant issue when we see evidence from other research as well, A recent research conducted by the Department of Work and Pensions revealed a stark reality. We see that only half of those people who leave work due to ill health are returning within 5 years. So this means that we need to take urgent action to help workers remain in their work, in their roles, as well as thrive in those roles as well. And we also see this as a symptom of the way we work isn't working. It's showing that the way we work right now isn't working for millions of people, and we need to start taking action to tackle this issue. So this research came with that idea. We wanted to explore how we can prevent more people from leaving the labor market, as well as also shift attention to proactive measures that retain workers with ill health. As part of this research, we also wanted to identify who is most at risk of becoming economically inactive and understand the priorities as well as challenges from an employer's perspective. So it was quite key for us to include the employer's perspective into our research findings as well. To achieve this, we used a mixed method approach that included an evidence review and then followed by a longitudinal analysis of the understanding society data set, which enables us to track individuals over time and identify key trends in those waves. We also commissioned surveying to gather insights from over 1,000 senior business leaders across the Great Britain and ask them questions around their policies about well-being and health at work, as well as their opinions on how we can improve the current system. We also held conversations with employers, experts, and stakeholders in one-to-one settings, as well as roundtables as well. So in terms of our research findings, one of the key findings was that we find the first year after illness is pivotal. So if employers and policymakers want to deal with people, prevent people from leaving work altogether, they need to act immediately after there is an ill health problem. We find that 4.2% of workers leave their jobs within the first year of a health setback, which is showing that the urgency for action. This might be, this action can take different forms, from occupational health services to earlier access to sick pay, but it is important to understand the urgency in taking action. We were also quite interested in what characteristics of jobs are enabling people to stay at work, as well as making them leave work. And what we find from this research is flexibility and autonomy are game changers. Autonomy at work are game changers. We find that employees are 4 times more likely to leave their jobs if they lack flexibility following a health setback. And here we tested the flexibility in multiple forms in the define it in the Understanding Society dataset. When we looked into the role of control over tasks, we see that women are 2.4 times more likely to leave work if they have no control over their tasks. And men with low job control are 5 times more likely to exit work after a negative health event. From these findings, we conclude that there is no size-fits-all approach to job design. So we need to understand the differences based on gender and other characteristics, but we see flexibility and autonomy at work are quite key. We were quite interested in also testing our findings to understand which types of worker groups are at higher risk. And maybe unsurprisingly, we find that workers with 3 or more health conditions are more likely to leave work. They are 5.6 times more likely to leave. And those with poor mental health conditions are also twice as likely to exit the work compared to others. This is also quite important as we see a rise in mental health issues among our population, especially the younger workers as well. We wanted to also test different characteristics like sector, socioeconomic income. There were less significant findings, but in terms of sectoral differences, there is a greater outflow into early retirement from industries such as education and public administration. But I think we need more research on these areas as well. So when we had conversations with employers and when we surveyed them, there was one thing that was super clear, that they recognize the challenges of ill health in the workplace. So from our survey findings, we find that we see that 44% of senior business leaders view absenteeism due to ill health as a serious problem. And this was quite apparent in our conversations with them as well. This issue is particularly pronounced in larger size employers than SMEs. They also shared with us when we had one-to-one conversations that they are seeing an increase in employees taking longer periods of leave. Some of these were all anecdotal, but some of them said NHS waiting list times are causing these delays as well. So for instance, they told us that sometimes employees, when they have their surgery, for instance, it doesn't necessarily take them that much time to recover, but they are waiting a long time to access the health service they need, which is also creating a burden on their capacity planning as well. The other issue, so there was a difference between short-term leave versus long-term leave being more of a problem for employers. And lastly, employers were also acknowledging the fact that the boundaries between home and work are often blurred, and they have more role to play in supporting individuals' health overall, which is a finding that we see in our other research done with employers as well. They recognize they have a greater role to play. However, while that's the case, we also find that employers are struggling to respond, as well as there's a troubling gap between what employers say versus what they actually do in practice. So in our research, flexibility and job control emerge as key factors enabling people to stay at work. However, when we ask employers how many of them provide flexible working arrangements to their employees, we find that fewer than half of employers offer flexible working arrangements. So in the report, we test multiple interventions that can help people with ill health to stay at work versus whether employers have these services in place. So for instance, when it comes to occupational health services, we see that more than 3 in 5 employers acknowledge the value of occupational health services. However, only 37% of them actually provide these services. And large size employers are more likely to have occupational health services, 47% versus 30% of SMEs. And this difference between sizes of organizations was quite evident in other types of policies in place as well. So our response to this challenge is developing this 3-level policy framework. We developed it together with Professor Stavroula. What we mean by this framework is that, so right now, maybe too much focus is on the downstream measures, which happen after ill health is already there. And when we are trying to either keep people with ill health in work or support them to get back. However, we want to see a change in this focus, and we want the attention to be more on the work design, job design, and organizational management, which we define as upstream measures. This framework, this doesn't mean that we shouldn't focus on downstream measures, contrary, but if we shift that attention, then this policy framework should allow us to protect workforce health, increase workforce retention, and achieve a sustainable sharing of responsibility between individuals, employers, and the policymakers, the government. So lastly, I just wanted to briefly mention the type of policies we recommend in this report. So in terms of upstream measures we want to see in place, as in line with our research findings, we want the government to ensure a genuine access to flexible working from day one. It's positive to see the proposals around flexible working in the employment bill. I think we believe they can go further than that. And secondly, while the UK compares well in terms of paid leave entitlements, which are key to support people take off time from work, we know that the access to these paid leave entitlements can vary a lot based on people's income or type of jobs they do. So there's a need to strengthen these entitlements to support workers. And while we have health and safety laws in place, they need to be updated to meet the current workforce needs. And there is also scope to extend the collection of the data as well. This would allow us to do better forecasting and monitoring of workforce trends as well. And in terms of midstream measures, we would like to see a roadmap to be developed to transform occupational health services and better integration of them with the public health. There are many countries that mandate occupational health provision, but there could be a roadmap to take us there. And in terms of the downstream measures, maybe I finish there as well. While the developments around statutory sick pay is welcome, we would like to see it to be increased to boost retention. There would be an equilibrium where we have better paid statutory paid leave, but still keep people go back to work. And we want to also see wage subsidies piloted and supported for SMEs, better support for SMEs from the government side as well. So maybe I can finish here and hand over to you, Alice.
Thanks very much, Asli, for talking us through the research, and I can see some questions already coming through, so that's brilliant. We will circle back to some of those. I'd like to now introduce Professor Stavroula Leka. Stavroula is the Director of the Centre for Organisational Health and Wellbeing at Lancaster University and a leading expert in workforce health. As a chartered psychologist, she's been an advisor to the European Commission, World Health Organization and the Department for Work and Pensions here in the UK. Stavroula's research focuses on managing the physical and mental health risks facing workers. She's a co-author of the report, and she has done a lot of work looking at the role of government policy in promoting healthy workplaces. So I would love to invite you in to respond to the findings there, Stavroula, and share some reflections on what this all means for government, employers, workers. Over to you.
Thank you very much, Alice, and thank you, Asli, for the presentation. I think we have been reflecting a lot on the findings, and I would like to say that a lot of these findings are not surprising. We know that we have the issues that Alice in the beginning outlined in the UK, but some of these findings are exactly the same across other countries. Issues, for example, in relation to, unfortunately, dealing with problems after they have occurred. So not very much adopting a preventative approach that can result in people not going off sick has been a struggle for many countries, not only in Europe, but internationally, first of all. So I think that there is a time for reset in the UK as well, as other countries have attempted in recent years, towards prevention. And the focus should shift towards creating healthy workplaces. But at the same time, not forgetting that this go hand in hand with support. And by support, we mean developing the right systems. There is the interface with public health or with the NHS in our case, and whether that works seamlessly or as it should to promote this type of approach towards prevention, but also the introduction of more specific services such as occupational health service, and Nick Pahl will talk about this more, I'm sure, in a bit. If we gear ourselves in this framework, then we'll have the opportunity not only to prevent, but to forecast problems. So the question that I get often is, do we really know what healthy work means or healthy workplace? And I see some questions there in the chat as well around what does flexibility mean? It's not only flexibility around working hours, it's actually flexibility around how we do our work and autonomy and control about how we do our work. And Asli referred to the different findings in relation to males and females there, that actually control in the way that we engage with our work also plays a role in whether people will feel that they can engage meaningfully and prevent their going off sick. So I think we do know what healthy work and healthy workplaces means. We actually can use our data better. There is some work there to be done to allow us to do this kind of forecasting towards prevention. And also to introduce the right policies, because if we look at the changes that have been, in a way, instituted in many sectors and for many of our workers since the pandemic, we do see that our workers seek more flexibility. They seek more meaning through work, but at the same time, they struggle with other socioeconomic factors that have the interplay with the workplace. So if we look at the future of work, then we need to be enabled to deal with the challenges as they are arising, and we know there will be a huge impact of the use of AI. And automation even more across different sectors. That means pervasive changes in how work is being done, who is working, and how. So I think if we want to keep our workforce, and we know that younger workers value their work and look for meaning in their work, well-being is a priority for them, we need to be considering how we can promote healthy work design, how we can ensure that healthy workplaces are in place, and how we can also support our employers to put in place those policies and practices that matter to achieve these results. I would also like to say here, if I'd like to take a moment, that we're very fortunate to have a very good collaboration with the Work Foundation. And in fact, we have a series of events planned. We started with the events before Christmas in London, and we have another event on the 23rd of January through the launch of the Lancaster University Work and Health Forum. We'll talk about this in a bit, but we'd love to see some of you there as well to continue these useful discussions.
Thanks very much, Stavroula. Yes, and that forum, we're particularly interested in employers participating there as well. So get in touch with us if you'd like to receive an invitation to that. So I will now introduce our second panelist, Nick Pahl, who is the CEO of the Society of Occupational Medicine, the largest and oldest nationally recognised professional organisation of health and work practitioners. Nick has greatly advanced the conversation on the UK's workforce health challenges. He's always been a friendly ear and advisor to us when we've been grappling with some of our research findings and methods. He has said a lot and guided us a lot on the future of the occupational health system, what we should be thinking about, how it should work in the UK. So I will hand over to Nick for some initial reflections.
Thanks very much, Alice. It's very generous of you. Yeah, I mean, just to say, I mean, obviously, occupational health is a big part of this report, which I really welcome, but it's only part of the whole problem. I mean, this report particularly focuses on in work, which I think is really important, prevention, and that's where occupational health has got a real role. But obviously, there's other really big sort of impact areas that the government needs to look at and is looking at in terms of people out of work and also the benefit system. So hopefully I can be humble and say this is just a part of the overall issue. I think just in terms of health, I think it's important that work and health is socialized amongst kind of healthcare professionals. And we're expecting any day now a statement from the Academy of Medical Royal Colleges, which represents pretty much all healthcare workers, on how important work and health is. So it's not just employers and in work, it's also when people engage with the sort of health professionals, they need to have that work conversations, just to talk about surgery. And I think that's going to be tough, actually. I think health professionals often advocate for the patient and they find these kind of work conversations kind of difficult, but that really should change because it's work is good for you and it's in people's interest to do that. I think also FitNote is part of that. FitNote being a real drag, I think, on this whole issue, and employers struggling. I think, you know, they did sort of perhaps devolve or, you know, say, okay, get your FitNote, and then they kind of struggle with getting that person back to work. And FitNote's currently over 95% not fit for work when it could be much more maybe fit for work. And the government said more people can sign it off, not just GPs. But that reform needs to happen. I'd say AI could be used to analyze fit notes and get rapid return to work, because we know that every day someone's off work, they're less likely to ever return to work. And I suppose this report and what the government needs to do is stem the tide, prevent people dropping out of work. That's the whole point. I mean, another theme of the report and what's been said is the way we work, and things like job design are important. And there are some really easy, as well as creating jobs that really work for people, but there are some easy things that people can do, both putting in place reasonable adjustments, which obviously occupational health can advise on, but also just some of the signalling from government in terms of, managing women's health at work issues, from sort of menopause right the way through the life course to men's health issues. I think they've set up a men's health focus. So I think signalling from government that work is good for you, and understanding that actually employers can make easy changes is a good thing. I think, obviously there's concern about the economy at the moment and more burden on employers. I think employers actually are quite still keen, despite obviously some of the signals from government in terms of national insurance and the economy generally. They're still keen actually for action to happen in this area. And I've talked to people from the CBI to the FSB, and they still want support. It's great that Charlie Mayfield and his team are going to do something in this area, and I think they could get actually quite a lot of traction from employers. CIPD, who we work with closely, representing HR people, really keen to make the changes, and some simple things that can happen. So we're really hopeful about that. And I think coming back to occupational health, the previous government did an incentive for occupational health in the Northwest, which had mixed results, which I think wasn't marketed properly. But the people who did take up occupational health with the government subsidy have now, even the subsidy's gone, using it ongoing. So people do see the value of it, but it's a hard sell, particularly to small business. And I suppose that's why we're calling for a universal access offer, or this report also signals that where large employers, vast majority, 80% plus of large employers have occupational health. I think the public would find it difficult if they weren't, all large employers didn't have occupational health. And I think the health and safety executive could have a role in sort of mandating and in stage way ensuring that happens. And then small employers, I think that there's the work well, the things that were announced in Get Britain Working Again. I think building on that in terms of local delivery, is so much local resources, and that supportive side rather than perhaps straightforward punitive, with an occupational health wraparound, I think would be a good way of doing it. And I suppose the last point is that a lot of people are quite confused about what's going on in sort of workplace health. And there's perhaps stuff in the papers about, you try yoga, mindfulness, new year, new you. And a lot of that is not evidence-based, as much as we all like some of that stuff. It's not actually for improving the health of the workforce. It's not necessarily going to cut it. And you do need an evidence-based approach. And occupational health people are trained in that, follow an evidence-based approach. We produced a report, which I can share, about choosing well-being products and services, because sometimes things drift to well-being and then it all feels a bit mushy and not very kind of significant in terms of making a difference. So we really want to say that occupational health are the evidence-based professionals, see work as good for you, not just going to go off and sit on the sofa people. That tough love actually does help people. So I'm really pleased with this report, and also happy to answer questions I've been doing and take part in the discussion later. Thanks, Alice.
Brilliant. Thank you very much, Nick, for that. And yes, I would say very much so the evidence that we looked at, so that the longitudinal study that Asli was talking about looked at 9,000 plus workers and their employment trajectory, and what factors actually kept them in the job whilst they were experiencing ill health. And that's where flexibility came up as the kind of key determinant. And that's more about job design than a kind of additional extra that's sort of added on once you become ill. And I know there've been some questions about kind of what we mean by flexibility there. So I'll just maybe briefly answer those before we get into the wider discussion. We were using the specific measures in the labour force survey and in Understanding Society. So it's measured in terms of control over different elements of your job. So control over the work pace, control over work location, the order of your tasks, and other elements like that. And there are also different types of flexibility in terms of flexi time, part-time, etc., that we also looked at. And generally what we found is that workers who had some kind of flexibility, so just any kind of flexibility at all, who acknowledged that they had that flex in their job, were the ones that stayed in work whilst they were weathering that storm. So that could have been different forms of flexibility, it could have been different perceptions of it, but it was that feeling that they had some control over how their job was going. And we can, you know, share the report so that people can take a look at some of that in detail as well. So I had a question to come back to you, Stavroula, because we've talked a bit about sort of international comparisons and the fact that some of these are you know, international trends. It's not just something that the UK is dealing with, but that generally other countries have got ahead, or some other countries have got ahead and are dealing or have introduced policies or new measures that have helped them weather some of these problems. Could you talk a bit about some of those international examples or sort of cases that you think are particularly positive in sort of specifically around this retention question of how we support people to stay in an employment relationship when they fall ill?
Sure. There are different ways to go about it. I mean, there are quite a few countries that, for example, have introduced new legislation to make the requirements around, for example, managing mental ill health or work-related stress more specific. In particular, Sweden comes to mind. I mean, they have had more specific legislation around this issue for many years, but more recently, and while reviewing the data that they have at national level, they decided to legislate more specifically around issues like working hours, flexibility, and harassment at work. And they identify them as the 3 key risks to people going off sick. So that's just one example. Australia has introduced new legislation. They're updating the Work and Health Act. And I think out of the 27 member states of the EU, now we see legislation in 16, more specific legislation, the European legislation, 16 of those. And they choose different ways to do it. So there are good examples out there that the UK can look at, even if not, you know, introducing more specific legislation, but updating the existing legislation, the policies that we have. There was a question there in the chat about how do we actually encourage the implementation of the policies, because we do have them in the UK. It's a legal requirement for the employer to proactively risk assess and manage in relation to work-related stress, for example. But in reality, we know that this is not done proactively. It's done very reactively. And so how do we get employers to understand how that can be useful? Because indeed, there is data to show that people who are healthier at work are more productive, and there is a win-win. It is a win-win situation for the organization as well. And so this notion of sustainable work that is quite new, and it is about keeping people at work with the right conditions of work for as long as they wish to. This is something that goes hand in hand with the sustainability of the organization as well. In the UK, the HSE is currently engaged in work that will look at probably updating the management standards for work-related stress to see whether they are fit for purpose or whether they need to be updated, or also considering new ways of working or the future of work. So that is a very welcome development. And also there will be new guidance for employers around interventions that can be useful for them. There are also government programs around occupational health services. In many countries, there is specific legislation that mandates who actually can provide such services, what are the qualifications that people should have, and how actually multidisciplinary occupational health services look like that can support this move towards prevention. And I think that is very, very important. It has worked well in different countries such as Finland. And whether we go to the detail of the law again, as in many countries have done or not, is another question. But there are examples we can look at. There are also examples around the employer's role in returning people back to work. The more, I would say, innovative or provocative example is that of the Netherlands, where we know now that for employers are responsible for up to 104 weeks of people being off sick for getting them back to work. And that is a big time period that employers are responsible for that. And that actually in the Netherlands, we have seen that has acted as a real motivator to get people back to work. So the different ways different countries have been doing things, there are a lot of examples we can look at. And I think we need to have that conversation about national reset towards prevention.
That's great. Thank you, Stavroula. Yes, I know a bit about the Netherlands example, and it is really interesting. So as I understand it, the kind of extension of the duty of care time is contingent on whether that employer can demonstrate it has done concrete things to support someone back into employment. And if they can't demonstrate that they've, maybe changed the job or changed the workload or done something else to support someone back into employment, then they will be responsible for paying sickness absence leave for a longer period. So it's a very interesting model. Nick, I wondered if I could come to you to maybe reflect a bit more on the review being led by Sir Charlie Mayfield and what you think the balance of responsibility should be that we take in terms of thinking through that employer role and then the government's role in supporting healthy workplaces. As often this comes back to the question of what do we need to legislate for? It might be that that isn't the question you want to answer, but it would be great to hear a bit about where you think that kind of balance of responsibility should fall and what the priorities of the review should be.
Yeah, I mean, I think it needs to obviously a bit of both, isn't it? I mean, government needs to show best practice in the people they're employing. They need to support their NHS staff, for example, good occupational health, support the military. I think that was over Christmas, New Year, the kind of lack of people fit to fight. So I think that investment in occupational health and government employees is really important. But this is, most employees are in the sort of in business sector. So I would expect Charlie Mayfield's review to focus in on that. I don't think it necessarily requires a lot of legislation. I mean, I think you can sort of use, for example, Health and Safety Executive to regulate and have like extra teeth. It doesn't necessarily require new legislation at all, as much as there are new challenges coming down the line, I think, in terms of AI and is the Health and Safety at Work Act fit for purpose, I think, is something to think about. As I said before, I think there's quite a lot of appetite from employers to pick this up and run with it. But that does need that signaling from government, like right from the top, that work is good for you. And also there needs to be concerted and greater investment from government in sort of work and health initiatives. I mean, the budget said it's about 240 million pounds for various pilots. This is a problem that's 50, 60 billion and growing, isn't it, in terms of benefit costs? And we know the return on investment when we talk to Treasury was every 100,000 people who return to work, Treasury gets 3.5 billion. So it's an incredible opportunity actually to invest to save. And so they're not going far enough, fast enough. Sorry, my dog agreeing with me, hopefully. So I really think that whole focus on this broad inactivity, not just the kind of in-work side, which is so important. I'm really pleased with this report. It's fantastic. That's a focus, and we hope occupational health comes through. The previous government was much stronger on occupational health, and I think there's a kind of, in a way, a free win from the Charlie Mayfield review to focus in on occupational health and build on what was achieved in previous governments. Thanks.
Thanks very much. Yeah, I mean, there's discussion in the questions and the Q&As about some of the policy areas that we've raised and talked about. I think we've covered a couple of them, but one that's come up in a couple of places is remote working and kind of changes to our working lives since the pandemic. I think, Stavroula, you were starting to talk about kind of the future of work and how our working lives might be changing, still into the future and how we need to get ahead of some of those changes. But it would be good to hear some reflections on how that specific type of flexibility of the kind of work location might be impacting some of the trends that we're seeing. And Asli, I don't know if you want to come in on some of this as well. But we have been quite interested in looking at remote working as both a positive and a risk factor in terms of mental health. And one of the things that Asli has drawn attention to in some of our other work is the inequality experience. So the inequality of experience, the fact that lots of workers actually don't have access to any of these types of flexible working, particularly remote and hybrid working, and how that can create kind of health inequalities then that are emerging in workplaces. Asli, were there any of those questions that you wanted to address directly? I think there was one asking about remote working, also about the government's flexibility from day one commitment and whether you think that will make any changes.
Yes, thank you very much. Those are great questions. On access to remote working, we didn't specifically differentiate different types of flexible working in this research, but from our other research, we know that our labor market has almost like multiple tiers in terms of access to these types of flexible or remote work. And some people, especially those in lower incomes or in certain types of sectors, occupational groups, are less likely to be able to access remote working. And sometimes when we talk about flexible working, people just automatically their minds go to remote working. But we also know from our other research that organizations who cannot offer people remote working can still offer them different types of flexibility. It could be around like the use of time or the type of jobs they do or their autonomy of work. And in our, obviously in our research, we always talk about the policies, and policies are therefore giving a guidance or framework for employers. And in one of our surveys, we also tested how many employers go beyond the statutory requirements in terms of flexible work, but in terms of other types of policies as well. Because technically employers can offer more than what is written in the law. But when we test different policies, we see that actually the majority of employers do not provide anything beyond statutory requirements when it comes to flexible work or different types of policies that could improve working conditions of employees. So that's why we are always starting with policy changes to policy so that we can set the minimums, and then people who maybe have more trouble in accessing these progressive policies in their employers can also have higher standards, and we can raise the minimum. When it comes to the flexible working question specifically, so we see a greater consensus is occurring around the need for flexibility at work. However, right now, what we have or what we've been promised doesn't necessarily make flexible working a default right from day one. So although the developments are positive, but we also know that businesses can still decline offers based on like they can make a case against flexibility. So I guess what we want to see is making it a genuine right from day one that all employees can access.
Yeah, and we see that as having kind of shared benefits as well. Because, yeah, I mean, partly because of the findings that we have here today, that it helps, you know, it's a huge part of the retention challenge. But we also see, and I think this is what some of the commenters have raised, the kind of boost to productivity when flexibility is introduced in the right way. So thank you very much for that, Asli. On the question of job design and the future of work, Stavroula, I wondered if I could kind of circle back to you to unpick some of those areas that you were talking about in relation to technology or how working lives might be changing, and what you think the government should be looking at or looking to do as part of the kind of forecasting or forward-looking approach to work and health.
Yeah, thank you. So there's been quite a bit of research actually over the past years around the future of work, and in all the reports that have come out, the number one priority for the future of work concerns psychological and social risks to workers' health and well-being. There is a term out there that psychosocial risk is exactly what I mean, but it's not this doesn't mean that we deal with the personal characteristics of the individual employee. It is more about how do you design working conditions and workplaces that promote healthy mental health at work, broadly speaking, and also healthy social relationships at work. And I think that if that is a priority, the number one priority, and in there we see a lot of discussion again around control, around flexibility, around clarity of roles, around support that should be provided, especially for particular groups of workers, then we know which way we need to go. The question is, are our policies up to speed to deal with these different characteristics and challenges in the future of work? And can we ensure that the people who actually work remotely will be included in these policies and will be supported appropriately? And that is very interesting because there are those who are proponents of technology solutions to these problems as well. So we have seen discussions around occupational health services provided online for groups of workers using different tools, for example. And we have seen countries moving to legislate around risk assessment in people's homes as well, to ensure that they have the right adjustments they need in their personal work environment. But all these are quite difficult, and we lack appropriate implementation at the moment. So I think there is a lot of work currently being done. We know what the characteristics of a healthy work environment look like, and there is a lot of research now about what the future of work would look like. But to ensure that those who are at most risk of dropping out of work do not, we need to ensure that we go for a more comprehensive framework that provides support, but also is geared towards prevention.
Thanks very much. And I know that, Stavroula, as we've been embarking on this research, you've really encouraged us to think about prevention really as the guiding light with all of this, because I mean, naturally, the area that we've measured is looking at once those health conditions already kind of reveal themselves, because that's when the data becomes available that we can measure how workers are impacted. But actually, there's more that can be considered about the kind of the run up to that, and the fact that work itself can be a driver of that ill health, which makes the whole thing quite complex. Nick, I see you've got your hand up.
Yeah, I'm busy kind of responding to these questions. It's really interesting. I mean, one point just being made is about the role of the manager, and the role of the manager, I think, is just one of the most important things out of today's conversation, and skilling them up, because they're just pivotal in terms of health at work. I did also want to say, in terms of good practice in occupational health, is getting there before the fit note and having those conversations around, they want to stay in touch with you, and what's going on in terms of kind of work and health conversation. Because once you go into fit note, as I said before, then you potentially lost. I know Jaguar Land Rover, one of their key metrics is ensuring occupational health is seen before people go off to fit note. And I think using also some questions around concern about confidentiality. One of the things that occupational health does the health needs assessment and health surveillance to see where people are using data to see certain people might be risk, certain teams, and sort of doing interventions on that, because sometimes there's a healthy work event where I said before, you can do some well-being initiatives for people who just they're healthy anyway, and therefore they're going to turn up. So you do need that targeted approach to impact on inequality. But some really good kind of questions. I'm trying to respond. So thank you for that.
Yeah, I appreciate you responding and typing in the chat there, Nick, because there's definitely too many for us to get through in the conversation. Asli and others, if you want to type and respond to any, please feel free to do so. We've got a few minutes left, and so I think what it might be nice to do is just to take a short round of kind of final comments from people in terms of what you think the government's focus needs to be within this Parliament. And if you want to answer any of those questions that are still unanswered in the chat as part of it, then feel free to do so. Asli, I think I'll start with you, then I'll come to Nick, and then I'll finish with Stavroula before sharing a few bits of information about upcoming research that we have. So Asli, what should the government prioritise?
difficult question, but I think so some of the issues we have today are long-standing issues and won't be able to be fixed with quick, I guess, plaster-like solutions. And we know, like, we are operating with short-term election cycles, so which is making policy making quite difficult from time to time. But I think the focus here should be cross-departmental action, because lots of the issues we see in the current labor market are symptoms of how we work, and how we work is not meeting people's needs. So they will require action from different departments from the government. So there should be cross-departmental action. And then while it is understandable that there is a greater focus on getting more people back into work, but just making that shift to more proactive policies and working closely with employers is quite key. I don't think any of the challenges we face today will be achieved, will be overcome without coordinated action with employers. So I guess maybe this is a task for us as well, making that business case over and over again, and strengthen that business case for action to tackle ill health in the workforce, and then raising the minimum through policies so that everyone can access healthy jobs, healthy, secure jobs that keep them healthy, and when they are ill, allow them to go back to work in a flexible way as well.
Thanks, Asli. Yeah, I totally agree on the kind of cross-departmental approach to this. We found with the research that we were, looking for kind of routes to influence, and also research done by so many different government departments, because this really does all relate. Nick, what should the government focus on in this Parliament?
I mean, first of all, I think, be careful what you wish for. And I put something in the chat about sort of women, the impact of more working at home, is that, people want flexibility, women want flexibility, we want flexibility, is it can end up women doing more domestic work, more childcare, not being at work and not getting those promotions. So people might call for flexibility, and then it actually ends up doing the opposite. So some of these policy decisions are quite critical, actually, in terms of things like gender pay gap and sort of caring responsibilities. The other thing is, I think I'd really focus in on the HSE, and I know we all kind of slightly roll our eyes, health and safety executive, health and safety, but they are really useful, and some other countries are really jealous of what we've got. So build on that. I expect to have Stephen Timms as a minister. I think he really gets it, and so I think they need to work with employers. I think HSE, if they get more teeth, they need to understand there will be impact on employers, but employers will be up for it as long as it's a sort of staged, reasonable approach rather than being bounced into it. So I would focus in on that, and then that sort of marketing piece. I know people then again might roll their eyes on that, but there really needs to be communication across from government and employers, and in terms of what can be done in this area, and simple things, and really to focus on that. In this pilot with occupational health, there wasn't any marketing for it, and so there wasn't any good take up, but people did take it out, really saw value of it. So it really needs to come centre face. I mean, it's definitely in the public discourse. The media, we're all concerned about people off work, and seeing teenagers and kids not going to the workplace having mental health issues. And I think that kind of work is good for you. Good work is good for you. Good point made by someone in the chat, because some work can be bad for you. Because we don't want our kids to be lying on the sofa feeling depressed. Get into work and be productive and have a sense of purpose. So I think HSE, purpose, and then some sort of policy nuance is necessary.
Yeah, I'm glad you picked up actually on that point about flexibility. I think somebody raised it in the chat as well, which is if we have a kind of individualistic approach to flexible work, whereby people make their own case for it and gain it on the basis of their needs, that's positive in one way, but actually it can produce unequal workforces. Like, as you say, women tend to take up more of that flexibility and lose out in their employment life and their careers as a result. I think looking at working time a bit more holistically, and time off work, paid time off, is an approach that maybe deals with some of that, where we aim to reduce working time or put safe protections around working time that are actually followed well, is maybe an organization-wide approach to dealing with some of those issues, rather than just going via the individual. Stavroula, your priorities for the government?
I mean, I really don't have much to add. I think learn from good practices of others. Yeah, we should not be inward looking, because as I said, a lot of these issues are actually found in countries around the world. Adopting a lifelong perspective to health and well-being is important as well, because we tend to deal with bits and bits of problems as they arise, and we need to do better than that. And then I think a reset, because we've talked about, as I've said many times, about support a lot. Support is very important, but prevention is more important. So how do we gear our policies and our practice towards healthy and sustainable work?
Thank you. Thanks very much. So I will wrap us up there just by plugging some of the upcoming work that we've got. So Stavroula already mentioned our Health and Work Forum, which is a collaboration with Stavroula's department at Lancaster, but also other academics within the Faculty of Health and Medicine at Lancaster University. And we're hoping it's going to be a really kind of vibrant, multidisciplinary forum for us to discuss some of these work and health issues and really talk about solutions and what the latest academic evidence is. We are inviting employers, large organisations initially to share their views with us, but we will also be including policymakers and practitioners and researchers as well as we get along. So if you want to join, please get in touch with one of us using the contact details on the Work Foundation website or via Stavroula, and we would be pleased to extend an invitation to you. We also are going to be publishing some new research in the next few months. There is a study that is supported by the Nuffield Foundation, being led by Dr. Paula Holland, looking at the role of remote and hybrid working, specifically in supporting people with disabilities to access good quality jobs and sustainable jobs. So we're going to be bringing out a series of publications with the findings of that study soon, so please do look out for that one. We also will have a briefing looking at the employment experiences of people with MS as a specific condition that we think we could learn a lot from, and really is something that's affecting the working age population significantly in the UK. And so we're really pleased to be working with the MS Society on that piece. And then we will be bringing out our Insecure Work Index later in the year as well. So please do look out for that. I would like to thank our panelists once more for their brilliant contributions today. I hope it was a useful conversation for everyone. We had a brilliant high level of attendance, lots of questions, over 100 of you there on the call. So thank you very much for joining us, and we'll see you soon. Bye-bye.